If your vet has prescribed Phenobarbital, Gabapentin, or Fluoxetine for your cat's seizures, trauma, or old age confusion, don't panic. These medications can be actually life-saving tools sometimes, but they can also come with serious limitations and sometimes serious consequences. In this video, I'll break down what traditional medicine can really offer cats with neurological issues and when these meds help and when they don't. Let's discuss. This is part 2 of our 4-part series on neurological support for cats. If you missed part 1, I highly recommend starting there because it sets the foundation by helping you understand what actually is going on in your cat's brain when trauma, seizures, or dementia change their behavior. And you should have somewhere on this video a place to click to go and watch that video first. So I am Dr. Paola Zanibelli-Davis, the Holistic Cat Specialist and founder of the Holistic Cat Club. I help you and your cat live extraordinary lives together by unlocking the secrets of natural remedies and positive training, because not having alternative options should not be an option. I'm a doctor of psychology and holistic pet health coach certified by the American Association of Veterinary Boards and trained in feline holistic care, therapeutic nutrition, and advanced behavior support. I have supported cat parents during the scariest moments, during serious illnesses, after seizures, during traumatic breakdowns, or when their senior cat starts showing signs of cognitive decline. And here's what I've seen so far. While conventional medicine can definitely stabilize the symptoms sometimes, it rarely leads to healing on its own. So it's good to take that as a part of the approach, but it's not the only thing that we can do. So in my psychology training, I studied psychotropic drugs, trauma therapies, and nervous system function. And I don't prescribe meds directly, but I work closely with vets and have a deep understanding of how these medications work and also when they fail to deliver. So let's talk about what traditional veterinary medicine can and can't do for your cat's brain and behavior. So first of all, an important point here is that when supporting cats with neurological vulnerabilities like PTSD or seizure disorders or cognitive dysfunction, etc., many holistic practitioners advise reducing unnecessary chemical burden. So this includes yearly vaccinations, topical flea meds, and dewormers. The WASAVA no longer recommends annual boosters. In fact, instead, vaccinations should match each cat's individual risk, particularly in older or sensitive cats, which is what we are talking about today. Chronic or frequent vaccines are linked to adverse immune reactions and even a risk of injection site sarcomas, which in cats are unfortunately particularly aggressive. And in a similar way, flea control chemicals, especially the ones containing isosazolines, carry documented neurological risks, including tremors, seizures, and also environmental harm, because with residues found in rivers, wildlife habitats, and even contaminating birds' nests. This is because people are under the impression that they're doing something good by brushing their pets and taking that fur that is accumulated on the brush and leaving it outside for the birds to build their nests, which obviously comes from a place of goodness. But unfortunately, when you apply these medications and these chemicals onto your cat, this fur is loaded with these chemicals. Birds die when they get in contact with these chemicals. So if you leave the fur, the treated fur out, and this is even a month later after you have applied these products, unfortunately, the birds will die because they get in contact with this fur. So that's another issue. But talking about cats in particular, yes, these things are neurotoxic and we want to avoid them as much as possible. It is okay. At the beginning, a vaccination set is good for kittens that might fall in that category of vulnerable kittens that can get life-threatening diseases, and the vaccination, the first set of vaccinations will protect them and will help them get the immunity that they need. However, after that, usually vaccines, they last for a very long time. So if you have a cat suffering from these conditions that we're talking about today, I definitely advise being very careful when you have to go for your annual visit and wellness visit. But I would be very careful in terms of adding an added chemical load to the equation. So given that each neuroactive medication, toxin, or immune event can definitely destabilize the fragile nervous system even further than what it is already, minimizing the use of these things whenever it's possible can definitely reduce the buildup of toxicity that we are talking about. And this way you can better support the neurological healing that we are addressing here. So we have a few classes of drugs available to us today to help with PTSD, seizures, and also cognitive decline a little bit. The first set of drugs that I would like to talk about are the anticonvulsants like phenobarbital or levetiracetam or zonisamide. These are often prescribed for cats who suffer from epileptic seizures and sometimes for trauma-triggered neural episodes. So the pros of these drugs are that, well, phenobarbital is one of the oldest and most effective seizure medication. It's been around for a long time. It reduces the frequency and severity of seizures by calming those the neural firing in the brain. And levetiracetam can be potentially can have fewer side effects potentially, and it's often used for cats that has a good tolerance with phenobarbital. So the cons of these drugs, however, it's mainly it's sedation, because unfortunately commonly some cats become really withdrawn and dull by using phenobarbital, and which is the drug that is often used for anesthesia. So obviously there is sedation involved, and liver toxicity is a risk with long-term phenobarbital use. And also these drugs can really shut down personality sometimes, because I hear cat parents say, oh yeah, they are seizure free now, but they really are not themselves anymore. So this is the main issue that happens with personality in particular. So these drugs can help cats with PTSD, even though they're not really designed for PTSD. They are more designed for convulsions, for epileptic seizures, but they can blunt the hyper arousal of in trauma cats that happens in trauma cats, and they reduce jumpiness and that extreme reactivity that happens after trauma. And unfortunately, they don't heal the trauma, so they simply sort of dampen the intensity of emotional reactivity. And this can be useful short term, of course, but it can be also risky if we never go deeper and never address really the root cause. So the second class of drugs I would like to talk about here is the anti-anxiety and behavioral medications. So drugs like fluoxetine or clomipramine or amitriptyline. So these are most often prescribed for trauma or aggression or excessive grooming or generalized anxiety, or even sometimes for inappropriate urination. So the pros of these drugs are, for example, the SSRIs, which stand for selective serotonin reuptake inhibitors, are basically antidepressants. And like, for example, fluoxetine is one of these, and is like Prozac for humans. And these can reduce obsessive behaviors, panic attacks, and aggression. So there is actually a pro in using these things. Sometimes they do reduce these behaviors. And then the TCAs, which stand for tricyclic antidepressants, like, for example, clomipramine that we have mentioned before, they generally help mainly with separation anxiety and sometimes inappropriate urination, and also sometimes with nerve pain. And they do provide some kind of emotional stabilization so that cats aren't constantly in some sort of stress loop. And the cons of these drugs, however, are something that is called emotional flattening, for example. So your cat can seem a little bit numb or disconnected. The long-term use of these drugs can lead to dependence and some GI issues, and also some withdrawal symptoms when at some point maybe you can't access these drugs all of a sudden, or you don't wean cats off appropriately. And also it can take weeks to take effect when you use these drugs. So during this time, symptoms can still worsen, because obviously it takes quite a while for the system to actually receive the effect of these drugs. And they can help PTSD cats because they suppress the intensity of trauma responses, but they don't rewire the brain. So this is something that we need to make very clear, as in what happens neurologically to the brain does not get changed by using these medications. These just make the raw reactions a little bit less raw and a little bit more softened, but they don't rewire the brain. And the problem is that many parents stop here and they stop using, with using these drugs. And then when they don't work, they don't know what to do. But actually, this is when behavioral therapy is useful, and a holistic approach potentially, because the brain continues to encode otherwise the trauma as unresolved and it's just a little bit numbed, but nothing is changing in the meaning that gets associated with the triggers that happen. And this is in PTSD in particular. So another drug that is often used is gabapentin. This is very, very frequently used, and it is a big one also. Well, it's used both in seizures and also in cats with trauma. So it's a neuromodulator that works on the GABA system, and it's usually commonly used as a mild sedative before before vet visits, but it's also prescribed for sometimes for chronic anxiety, for pain, and also sometimes for seizure support. It helps by reducing excitability of the neurons, and it's usually quite fast acting, unlike the antidepressants that we have talked about before. And so it's great for short-term use, like, for example, a fireworks an evening that is going to happen soon, or again, a vet visit that is coming up. But maybe not for long-term use, because in PTSD cats, well, it does lower reactivity without full sedation, but only short-term, as we are saying now. So the downside is that it doesn't address again the root cause, and can cause lethargy and sometimes some imbalances, especially in seniors. Seniors are a little bit more delicate. We need to be a bit careful with what we use, and it's usually, as I said, helpful when it's strategically used for short-term things and events rather than long-term, and unless obviously it's truly the only thing that works for you, so, and it's truly necessary. So now we haven't talked about dementia yet, and there is actually a neuroprotective drug, like it's called selegiline for dementia, and selegiline is one of the few drugs that is approved for feline cognitive dysfunction. It works by modulating the dopamine and supporting cognitive function. And there is something I want to say about dopamine a little bit later on. Let's address the drug first. So the pros of this drug is that it can potentially slow down early signs of feline dementia, and also it can improve sleep cycles, the sense of orientation, and social interaction for a while. The issue with this is that the effects are mild to modest, and generally and usually they are quite temporary. So usually it's more helpful in early stages dementia, and it becomes ineffective when dementia is a little bit more advanced. And also it can cause restlessness and also increase vocalization, which is one of the things that happen with dementia. So I don't know about this drug. I think in this case, paired with, of course, you can pair it with nutritional therapy and brain support, and this can complement the full approach to support aging cats. But I also feel that in cognitive dysfunction, holistic remedies and environmental adjustments are what works best, actually. So we will talk about holistic remedies later on and therapies later on in another video, which is part 3. But right now, so let's discuss why medication alone doesn't heal trauma. So we mentioned this a little bit before, but in short, basically, trauma recovery is not just about numbing the threat response, but it requires reassociation. So your cat's brain doesn't just need fewer reactions or numb reactions. It needs to rebuild new meanings. So to build new meanings around the sounds, the people, the situation, so all those triggers that currently feel threatening and engage that threat response. So threat responses not only trigger the fight, flight, or freeze reactions, but also they stimulate the areas of the brain that are linked to the production of dopamine, which is a neurotransmitter that you probably know this already, but it's a neurotransmitter that plays a key role in the brain reward system and motivates behavior. So sometimes they call it the happy hormone. This is what it does, really. So this is very important to say here, because this is exactly what we can use to rewire the brain through the behavioral therapy that we have mentioned before. And by addressing the situation through a holistic perspective, this is how we can get to actually get to the root cause and resolve the trauma. So there are several therapies that we can use for PTSD. For example, most of them involve a lot of dialogue, and this is with people, obviously, because since you can't sit your cat down and have a good old chat, obviously, you are going to do this in the same way with cats, but using a language that cats can understand. So you need to use, for example, play or environmental changes and things that your cat can relate to, so that you can use that language to communicate different meanings to those triggers that caused the trauma. This is absolutely key in resolving the trauma. You cannot just resolve the trauma with medication. You're going to numb the reactions, and you're going to sedate your cat potentially, and flatten his personality or her personality, but you're not going to resolve the trauma that is underneath and causes the real issue. So medications, as we said before, they can dull the threat response, but they can't assign the new meaning to it. So this is where behavioral therapy, as I said, comes in, and you can use desensitization, counter conditioning, neurological enrichment, sensory stimulation, and this can help the brain unlearn fear and relearn safety. So the magic happens exactly here, where behavioral therapy works, and then cats can often be weaned off medication safely and successfully, obviously under your vet supervision. So when do these drugs actually make sense? So for example, phenobarbital makes sense and is indicated when seizures are frequent, they're violent, they are life-threatening. Absolutely use phenobarbital, put it in the mix, because this is at this point necessary, at least for a while. Fluoxetine, for example, is indicated when anxiety is preventing those basic, that basic quality of life or safety. So at that point, when things become a little bit hard to handle, fluoxetine is definitely indicated. Gabapentin is indicated before those triggering events that are short term, and they are particular events that you can define, like the vet visit that we talked about before, or maybe as a bridge during trauma recovery. So for a little while you are actually using behavioral therapy also to change things around. So ensilegiline, obviously for dementia, for early cognitive dysfunction, knowing, of course, that its effect might be modest and temporary, like we mentioned before. So in part 3, we will discuss how a holistic approach can help and how you can implement it at home, and so that you can rebuild your cat's nervous system from the inside out. And before you go, download your free 5 steps to longevity guide using the link in the description below. If you are serious about helping your cat live a long, happy, healthy life, this is your first step. Download it, print it, use it, and the link is down there for you. So I will see you in part 3, and until then, love your cats as much as you can.